Welcome one and all to the Managing Morgellons Lance channel. My name is Lance and I'll be your host. Today is a very special day in the world of Morgellons disease advocacy. I will read to you the letter that I wrote earlier today to 30 government-related institutions and representatives which are responsible for Morgellons disease here in Canada, including the Prime Minister, the Right Honourable Justin Trudeau. Please keep in mind that even though you do not live in Canada, this is just as valid to you all, since you can do the exact same work in your own country. As a Morgellons disease patient and advocate, it is my determination that all Morgellons disease patients will be validated as soon as possible, and that those in charge be held accountable. I also want to thank the 61 subscribers from around the world to my YouTube channel. You all amaze me with your strength and courage and outspoken voices. And I don't even know who most of you are, and none of us have ever met face to face. But one thing is for sure, we are going to succeed in causing Morgellons disease to be validated by the government finally, after 20 years of complete inaction and unnecessary suicides of Morgellons disease patients. Just before I begin, I find it very important and necessary to call out the vision and mission which is guiding me through this process and is a light to this world as far as all Morgellons disease patients go. Please listen closely and speak it along with your hearts and your minds. The vision and mission. I am telling the world about Morgellons disease and creating a safe space for others with this condition to come forward and share their stories. I am standing up for the human rights of all Morgellons disease patients by validating, respecting, and spreading awareness about the reality of living with Morgellons disease. I am supporting other Morgellons disease advocacy projects by associating, promoting, and engaging. The vision is to end controversy surrounding Morgellons disease by compelling the CDC to conduct a legitimate study and validate this infectious disease. We seek a public apology from those in charge of handling the corrupt CDC Morgellons study done in 2012. All major news outlets must do a story when this happens. All Morgellons disease patients can seek effective treatment without fear of misdiagnosis, gaslighting, and rejection. And now for my letter dated today, July 5th, 2021. Oh, and please brace yourself because this was a difficult letter to write. It could get a bit intense. Here we go. To the Prime Minister of Canada, the Right Honourable Justin Trudeau. As the spokesperson for Morgellons disease patients here in Canada, it is with great concern and it is of the utmost urgency that I deliver this communication to you today. Thank you for taking this matter seriously in accordance with your last response of June 1st, 2021. On May 21st, 2021, I brought forward to your attention the Morgellons Disease Global Pandemic, including 160 pages of documentation to prove it. It is with great assurance that I must again call to your attention the unmanaged Morgellons disease epidemic spreading throughout Canada right now. It has been this way since the early 2000s and continues to this very day without any control or prevention efforts by the CDC or by Canadian healthcare authorities. Morgellons disease is an emergency healthcare crisis like no other. This urgent crisis must be acted upon immediately and with great seriousness equal to that of the Canadian emergency response afforded to COVID-19 patients, without further discrimination. Those afflicted with this horrid disease experience extraordinary and immeasurable levels of suffering on a scale most ordinary Canadians and people around the world will never know. This infectious disease causes microscopic fibers to grow throughout the skin from head to toe during all waking hours. living with Morgellons disease is nothing less than torture because the fibers cause sensations similar to bugs crawling beneath your skin. This disease affects babies, children, teenagers, adults, and seniors, and there is no treatment or cure. This is a multi-system disease affecting the entire body beyond just the skin fibrosis and is consistent with symptoms of chronic and debilitating Lyme disease. According to Dr. Randy Wymore, head of the Oklahoma State University Center for the Investigation of Morgellons disease for the past 15 years, this disease is caused by an infective process. The following scientific study proves how the bacteria responsible for causing Lyme disease, Borrelia, attacks our human skin cells, resulting in a disease process described as skin fibrosis. And then I provide the link, which I will attach below, along with all the other links to follow. As you are well aware from my May 21st, 2021 letter, instead of validation for this infectious disease, which cannot be denied based on irrefutable fibers seen beneath unbroken skin of patients, and a collective of 16 scientific studies found at the Charles E. Holman Morgellons Disease Foundation research page, link, Morgellons disease patients are discriminated against, dismissed, humiliated, and abused. We are told by members of the medical profession that, in accordance with the flawed 2012 CDC study on Morgellons disease, there is absolutely nothing wrong with us, and we are delusional. Medical professionals follow CDC conclusions and are prescribed antipsychotic drugs without a legitimate psychiatric assessment. Furthermore, we are denied a proper physical examination and told our disease doesn't even exist. Our very serious health complaints are diminished to the extent that every single one of us are being told we're crazy. These are atrocious, institutionalized human rights violations being carried out across Canada, of which most consider to be institutionalized crimes against humanity. With all due respect, based on the evidence, your office is responsible and must be held accountable. The most astounding part of this story is how anyone can see these fibers with their own eyes when they look through a microscope pointed at a Morgellons disease patient's skin. There is no other disease like this on Earth, and according to the Tulsa, Oklahoma Police Department and FBI, there are no other fibers like these in existence. According to peer-reviewed scientific studies, these fibers are composed of the human body's own collagen and keratin, and they grow from fibroblasts and keratinocytes, skin cells. Morgellons disease has also been documented in dogs, and I provide the link. The entire Morgellons disease patient population, myself in particular, were filled with a great sense of hope when we received your enterprising reply of June 1st, 2021, indicating that you had carefully reviewed the contents of my email and had immediately forwarded this to the attention of the Minister of Health of Canada, the Honorable Patricia A. Hadjdu. As the Morgellons disease spokesperson for Canada, the time has come where I must strongly escalate measures to call out for accountability from the Canadian government, the Office of the Prime Minister in particular. This uncontrolled healthcare crisis of 20 years cannot go on for another day. We, the Canadian public, voted you in office, and we count on your integrity as our faithful leader. As Prime Minister of Canada, what are you going to do about this uncontrolled epidemic? the Morgellons disease patient population here in Canada and throughout the rest of the world require an emergency action response, and we require that the media report this. We are through waiting around for answers while we watch our fellow Morgellons disease patients commit suicide in despair. It is regrettable that I must characterize you in the following way, but you must be made aware that these suicides are on your hands, as it is you who are in charge of this great country of Canada, where these atrocities are taking place on your watch. As you have been made aware, I am in possession of proof from the office of the Minister of Health of Canada, from as far back as 2009, that you, the Canadian government, knew full well that Morgellons disease was a global pandemic, and that you, the Canadian government, were investigating it at that time along with the Public Healthcare Agency of Canada. The Canadian public is calling for accountability with myself as their loyal Morgellons disease spokesperson. It must be said that it is absolutely inexcusable how since 2009 nothing has ever been done, that members of the Canadian government have kept this hidden from the public for the past 11 years, that the Canadian Broadcasting Corporation won't investigate it, and it is even more difficult to believe that after my compelling letter of May 21st, 2021, and after having received a response from your office indicating you are taking this matter very seriously, and have forwarded this to the attention of the top healthcare authority in Canada, the Honourable Patricia A. Hajdu, that still nothing has been done. I am forwarding you a copy of the most recent urgent letter I personally sent to the Minister of Health of Canada, of which I have yet to receive a response. The questions contained in this letter today and the letter to the Minister are extremely important for all Morgellons disease patients here in Canada, and they need to be answered as soon as possible. I require that answers be provided to this letter and to my most recent letter to the Minister of Health of Canada. Thank you for your attention and anticipated cooperation regarding this extremely urgent healthcare matter, which affects all Canadians either directly or indirectly. Please keep in mind that there are Canadians who continue to become infected with the bacteria responsible for causing Morgellons disease right now, and they are guaranteed to face enormous institutional discrimination beyond their wildest nightmares without your immediate intervention. God forbid, for all you know, you and your family could be next. What would you do then about this infectious disease with no cure? Would you then take the required actions to validate Morgellons disease once and for all? Please, the Canadian public requires you to take affirmative action now. I look forward to your most immediate response. With profound respect for the office you represent, Lance Tykolis. For more information, see my Managing Morgellons Lance Facebook page and my Managing Morgellons Lance YouTube channel, and my email, managingmorgellonslance@gmail.com. For more information on Morgellons disease, please check out the Charles E. Holman Morgellons Disease Foundation. And at the end of the letter, I specify that I require a receipt of your office having received this urgent communication. Thank you very much in advance. This brings an end to my letter, but for the record, I am going to read out the 30 individuals that this letter is now in the possession of across Canada. And it is these individuals who are going to be held responsible and held accountable for doing the right thing and validating Morgellons disease in accordance with the scientific studies available which prove Morgellons disease is real, not to mention all the patients, over 1 million patients worldwide. Who knows? It could be 5 million, it could be 10 million. Nobody's doing anything about it, and until they do, we'll never know. So these are the 30 members of the Canadian government and related healthcare institutions, and those who apply to this. Number 1, the Prime Minister of Canada, the Right Honourable Justin Trudeau. The Minister of Health of Canada, Patricia Hajdu. The BC Centre for Disease Control, Christy Kerr. Health Canada, Dr. Stephen Lucas, Deputy Minister. The Public Health Agency of Canada, Ian Stewart. Dr. Teresa Tam. Dr. Howard Njoo. The Centers for Disease Control and Prevention in the United States, Michael Beach, Media Relations Spokesperson, and the head of the CDC, Rochelle Walensky. The Canadian Centre for Emergency Preparedness, the Director General. The Minister of British Columbia, John Horgan. The Minister of Health of British Columbia, Adrian Dix. The Minister of Health of Alberta, Tyler Shandro. The Minister of Health of Saskatchewan, Paul Merriman. The Minister of Health of Manitoba, Heather Stephenson. The Minister of Health of Ontario, Christine Elliott. The Minister of Health of Quebec, Christian Dubé. Minister of Health of Newfoundland, Dr. John Hagee. Minister of Health of Prince Edward Island, Ernie Hudson. Minister of Health of Nova Scotia, Randy Delaray. Minister of Health of New Brunswick, Dorothy Shepherd. Minister of Health of the Northwest Territories, Julie Green. Minister of Health of Nunavut, Lorne Kusugak. Minister of Health of Yukon, Tracy McPhee. The Royal College of Physicians and Surgeons, Ian Baumer. The Canadian Dermatology Association, Catherine McCuig. Association of Medical Microbiology and Infectious Disease, Ricarda Galeotto. And finally, the last two, the Canadian Psychiatry Association, Dr. Ada Sincor and Rob Cornforth, and finally, the Minister of Public Safety, Bill Blair. Thank you very much for giving me your undivided attention in hearing this call for accountability of the Canadian government, healthcare authorities, and related institutions. This really is a healthcare crisis like no other. I can't believe it's gone on for this long. 11 years later, since the Public Health Agency of Canada has been investigating this. They haven't reported a single thing on their website. You can't get any information. It's hopeless for Morgellons disease patients without the intervention of the Prime Minister himself, the Right Honourable Justin Trudeau. And for all other healthcare authorities throughout the world, and for all the world leaders, it is us patients, the ones who are sick, that have to call out to them, asking them, pleading with them, could you please do something about this? The CDC is out of control. They won't do a single thing to change their position. When advocates like myself and many others have attempted to communicate to them this emergency healthcare crisis, we get ignored or defer to some other department outside of the CDC. There's no excuse for this. Action must be taken now. and I look forward to your immediate response. Thank you very much. This is Lance from the Managing Morgellons Lance channel. Good health to you, one and all.